So I guess in hospitals, one of the luxuries we have is we've got height adjustable beds. Now, maybe some people do have that at home, but not many people. So I guess it's important to think about the relative height of our beds in terms of our ability to get safely on and off them. For some people, beds need to be higher. For some people, occasionally, they need to be lower. Ideally, you probably want your bed height to be more or less mid-thigh for a lot of people. That way, when you sit on the bed, it's not so difficult to get up. Some beds that I've encountered are as low as 44 centimetres, and that's quite low when we come to beds. For some people, that won't be an issue. It really is very individual. Now, if you can easily get on and off the bed, that's wonderful. But maybe at times it's more difficult. What I'd suggest is you think about what part of your body is your most concerning bit and be kind to that part of you. So for some people, they might be able to turn like that, and then they might support themselves with their upper limbs as they gradually go down onto the bed. For some people, that won't work so well. If their problems are mainly to do with their backs and spines, what they might prefer to do is actually start to get their leg up and get both legs up and then to roll onto the bed like so, and then to bridge and position themselves onto the bed. That person might equally find the best way to get off the bed is to roll, we call that log rolling, and then to get their legs over the side and use the momentum of their legs getting over the side. Now that's doing it fairly slowly. If I do that much more quickly, the momentum involved really does help me to get up. So I'll just do it quickly so you can see the difference. So here I am on the bed. If I roll and then get my legs off fairly quickly, that really helps with the momentum of that. Sometimes if we're feeling a bit tentative, we don't want to move quickly, and that's fair enough. But the main thing is that we do it safely. I think another important thing to say to a lot of people is that once you've come to sitting, pause for a moment just to let your blood pressure equalise a bit in your body. Let that volume of blood come up to your head so that you don't have a dizzy moment. Sit for a minute or half a minute till you feel, yeah, I'm not dizzy, I'll be fine. Then stand up, and again, maybe stand, and again pause for a moment. Maybe have your feet shoulder width apart for stability, and then just have that little pause before you start walking off. Now, one of the devices that some people would use to assist them with that would be to have a bed rail, and you can get portable bed rails that just temporarily slide in. In hospitals we often have built-in bed rails, and these days it's quite common to find a bed rail that in hospital that just does the top end of the bed, like this one does. Probably easy if I get off the bed to pull it up actually. Click in. And so then I can get in down here, get my legs in, I can hold that for support. Gosh, that was so much easier. Now, I'm a bit far down. I could either move my pillows further down, or I could, if I was able to, I could shuffle up the bed. That might be a bit difficult for some of my joints, so I might just choose to bring the pillows down. I'm not tall, you can see that, I'm not a tall person, so that's easy for me. If I was 6 foot or over, I would perhaps not use this sort of bed rail so happily as I can at 161 centimetres. So that's quite nice to have something to pull up as well. If my back or my knee was the issue, you did see me using my upper body, my hand. Obviously I had to have the ability to grip like that. Other sorts of devices that I've used for different people have been bed ladders. That was the one that, gosh, I'm looking back to 40 odd years ago. 40 years ago there were less devices available, but certainly where I trained, bed ladders that actually attached to the bottom of the bed that gave people something to hold as they brought themselves to sitting were quite popular. I guess, as I said in the beginning, it really depends on which part of your body you're trying to protect. So Deborah, how would you generally get in and out of bed?
I would, this is a high bed for me because my feet aren't even touching the ground, so I would definitely sit down first.
Yes.
And then I would bring the two legs up and just lie back. Simple.
Yeah.
And then getting out of bed, I'd probably sit up first and then just and sit for a second or two, yes.
And what would you have over you in bed? Would you have a doona, or would you have sheets and blankets? Or
Just a very light sheet and blanket.
light sheet and blanket. And do you avoid tucking them in to make it easier
Yes,
to
I
get
do.
your legs in and out?
Yes, I do. I do avoid tucking them in.
Yes.
The bottom sheet obviously is tucked in,
Yes,
but otherwise, no, they're not tucked in.
One interesting thing I've seen and actually had some samples sent to me of was a sheet called Wonder Sheet. There's a person in Australia who makes a thing called the Wonder Sheet, and what they've got is they've got a polycotton at the top and the bottom, and then in the middle section where our bottom and the heavier parts of our body are, and mainly the trunk of our body, she's actually done that as a sort of a satin to help us with our sliding in and out. So for people who find that sliding in and out difficult, and she does them in different sizes, which is good for the bottom sheet.
Yes.
Yeah, you may have seen these. These are the leg lifters. This one's actually for both legs, but you can adapt it just to use it for one. So when it's for both legs, it's like that, or you can push that along a bit and then it can just have the single loop. And what you do, it's a semi-flexible thing, so you hook it under one foot and then that allows you to lift the leg into the bed with less effort for that particular leg. So particularly for someone who's very swollen after lower limb joint replacement, a lot of my patients find that helpful. I've even had people with very widespread arthritis who've purchased one to continue to use, and they've used it to help their legs get in and out of the car as well. Yeah.
It's exactly the same principle. Really.
Yeah.
As a bed.
Yeah. So this is, as you can see, a device to help you get in and out of the bed. I'll just put it in place. It's a portable bed rail. So what you need to be able to do is to lift the mattress. So if you can't do that, then you need to get someone else to do it for you. In this case, it's just made a little bit more difficult by the fact that we've got the built-in bed rail. So I can just lift that mattress. Now obviously that's a very light hospital mattress. I can lift it easily. But if it was a big heavy mattress, I'd get someone else to help. You can see what I've just done. I've positioned it down at the head end because what we want to have it so that it's not stopping our legs getting in and out. We want it to hold for our upper body. And I think Ash was saying at times she has found something similar to be useful. And I think a lot of people do, because it just means that you've got, and you decide how you want to hold it. You might hold it over the top, you might hold it like that. You decide what's comfortable for you, and that way you can hold it as you go down. And then you can also hold it as you come up, and it can actually facilitate something of a log roll.